Hello and welcome to this discussion on infection and transmission. In this video we'll be talking a little bit about infection and what that looks like within a population, and then also some of the concepts about transmission and prevention of transmission. So let's go ahead and get started with a graph that I find really helpful, and that is to think about the total population. And so I'm just going to put here's our total population, and if we're thinking about this total population, when we are trying to get a handle on infection and understanding what's happening, a lot of times we break this population down into smaller and smaller components. So I'd like to build this first of all by saying, of that total population, there is a certain part of that population that is susceptible. So I'm going to draw that with a green line, and we'll go ahead and just put that in here like so. And this is our, I'll say, number susceptible. Specifically, the number susceptible is those who could possibly get that particular infection that we're talking about. And so if we're thinking about, say, let's say this is the flu, maybe this is the number susceptible are the people who do not have immunity to that particular flu that's going around, either natural immunity or because they had some kind of vaccine. So here's the number who could even possibly get that infection. The next subset is of those who are susceptible. There's only a subpart of that population that is exposed to that particular pathogen. So I'm going to draw another subset here, and this is the number exposed. And of those who are exposed, we have a lot of immune functions that prevent us from being infected. We have the skin that's covering our body, all the mucous membranes. We have things in our GI tract, in our lungs, even the tears that are in our eyes help to keep those pathogens out. So I'll say of those who are exposed, there's only a subpart that becomes infected. So here's the number that are infected. And of those who are infected, there is only a subpopulation who gets sick. And so I'm going to draw another little subpopulation, so I'll say the number sick. And these are the ones that we call our cases. We'll come back to exactly what that means. And then there is a subpopulation of those who get sick who die. And so this is the severe cases, number who die. And we can use these subpopulations to think about a lot of the concepts that you've learned in your particular chapter. And so specifically, if you think of the number who die out of the number who are cases, that is our case fatality ratio. So if you say die per sick equals case fatality ratio. Now, one of the things that's really important to think about when we're talking about these different possible subpopulations within the total population is that these are much more difficult to measure than you would think. And you would say, oh, okay, well, maybe it's pretty easy to measure the number who die. Well, that can also be somewhat tricky. We learned last quarter when we talked about death certificate reporting that those things that are included on the death certificate, first of all, are not always accurate. If there are more than one thing going on with a person, let's say they have both HIV and TB, and maybe they're malnourished, and so they have this kind of multiple causation, what is included on the death certificate is somewhat unpredictable. And so sometimes certain things will even be left off entirely when they did have a significant contribution to that particular person's death. Measuring the number of cases can be tricky. This has to do with the whole concept of spectrum of disease. And if you think about the spectrum of disease, your textbook does a really nice job of showing that you can have anywhere from mild disease to moderate disease all the way to death, which is more obvious. But if a person has disease and they have signs and symptoms, and I'll talk about that in a minute, they may or may not go to the doctor. They may just take a day off work, or they may just still go to work. And so even if a person is a case, even if a person is sick, they may have such a mild version of that disease that we're not aware of it. And so it's sometimes difficult to get a handle on exactly how many cases we had. Also, people can have different presentations. So I said I wanted to talk about signs and symptoms. And so let me go ahead over here, and for the whole idea of cases is that they have signs and symptoms. And I want you to be familiar with these two terms. I think a lot of times people get them confused. I'm going to draw something here, and you'll recognize it right away. What exactly is this thing? It is a stop sign. A sign is something that you can see, and so it's something that is objective. So for example, you can see that a person has a rash. You can measure a person's white blood cell count. You can take their temperature and see if they have an elevated temperature. So these things that are objective are signs. Symptoms, on the other hand, are things that the patient will tell you about. And so they might say, I have a headache, or I feel nauseated. And so symptoms are things that you can't see, but that you can ask the patient about. I feel dizzy. I just don't feel well, kind of that malaise. So any particular illness can have a variety of different presentations, and that makes it a little bit difficult to determine how many people you have that are sick. The next subset is those who are infected. And infected a lot of times has to do with measuring a person's biological markers, because not everybody who's infected is going to show signs and symptoms of being sick. So infected can also have those people who don't have any signs or symptoms. So in order to know that they were infected, in order to know that they had some kind of an immune response, you would have to do things like take a throat culture or draw their blood, and that's often very difficult to do. So for a large population, it's hard to know how many were infected. It's also difficult to know exactly how many were exposed, because there are varying degrees of being exposed. Were you exposed if you were the primary caretaker that was in the room with that person who was coughing? Probably. How about if you just visited the house, but you didn't go in the room where the person was staying? Sometimes we would count that still as a person being exposed. What if you just delivered the mail to that particular residence? So the exposure can be along this kind of gradient, and it's difficult to know. Exposure has a lot to do with contact tracing, and so we'll often ask, who have you been around? And it can get really tricky if that person has gone to a public space. Maybe they went to the grocery store and they were coughing and coughing and coughing. They don't know. If they were in a more enclosed space, like a dormitory or an airplane, a lot of times we can get the names of the people who we think were exposed the most, like on the airplane with that person. But what about the other people that just happened to be walking through the airport at that time? Sometimes it's really difficult to get that exposed number. Susceptible is another concept that we try to pin down. If a person already has immunity to that particular infection, then a lot of times we try to remove them from the equation. But that's also a difficult thing to measure, because it has to do with looking at immunity levels. There are levels of certain antibodies. So that number that's susceptible can be kind of tricky to figure out. Even the total population that we're after can sometimes be challenging. So if we're trying to look at the total population for a specific city, do we use, say, the census data? Census data is often several years old, and we know that people enter and exit the population. Sometimes the demographics of a population can change pretty rapidly over a short amount of time. And even if we're looking at the population of a specific set, the population maybe that lives in a dormitory or that lives in a nursing home, we know that people are present, or maybe they go home for short periods of time, or they leave because maybe certain people died of something else during that time frame. So measuring any of these things can be challenging, any of these numbers. And once you get into actually looking at infectious disease epidemiology, you can see more and more how that can be challenging. So let's look at some of the equations that go along with this. And here's the first one, the number that die over the number who are sick, and that's called our case fatality ratio. If we look at the number sick divided by the number infected, that is known as virulence. In other words, how likely is it to have actual illness once a person is infected? And this can tell you a lot about the organism. Now, your textbook tells you that the case fatality rate can tell you something about the virulence, and this is especially if a very large percentage of the people who become sick actually die, and this is the case. So for example, in terms of rabies, a very high number of people die, or even measles, which we don't have around anymore, but it can give you a clue about that, especially if you don't have a high percentage that are inapparent infections. And so people will use these terms a little bit loosely, but just kind of keep in mind what the underlying concept is. The next concept has to do with those who are infected over those who are exposed, and this has to do with the infectiousness of that particular organism. So infected over exposed. In other words, how easy is it for the organism to gain entrance, in other words, into a person's body? So this is infectious. So, or infectivity would be another way of thinking about that. There's another term that, and it depends on the textbook that you're looking at, but your textbook says the number of sick, and I'll draw this in a different color just so that we can kind of see it a little bit easier. The number of sick divided by the number that are exposed, and this is known as the pathogenicity. So let me move over here a little bit. Sick divided by exposed, and that's the pathogenicity. So we try to figure out who exactly was exposed to that person and how many of them then developed signs or symptoms and got sick. So this is a feature of that particular organism. How pathogenic is it? How likely is it that it will both infect you and make you ill from that? And later on, we're going to see that the attack rate and the secondary attack rate really have to do with this idea of sick over exposed. Sometimes you'll see that attack rate being related to sick per susceptible. And so you really need to be very clear about what exactly it is that we are defining as the numerator and denominator. So people use these terms a little bit loosely. Understanding what you're trying to get at is an important piece of that. A lot of times with immunizations and herd immunity, as we'll see later, one of the things we're interested in knowing about is how many are susceptible out of the total population. And so that's something that we'll talk about a little bit later. Okay, so let's move on now to the whole idea of transmission. And with transmission, we are really wanting to know, how does that particular organism get from one person to the next? And there is both direct transmission and indirect. So direct transmission means that that person who was sick, here's the person, they have a rash, maybe we'll give them a rash. That sick person directly, either by direct contact or by coughing, so here they are, they're coughing, droplets, or it's so small that it's just plain old airborne, that person can directly give that illness to another person. There's not really something that's in between. With indirect, there is either a we have the person who's sick. I won't draw all the little spots on them, but there's something in between. It could be a vehicle like food or water. It could be a fomite. A fomite is an inanimate or not alive thing that transmits. Could be that a person who was sick touched a doorknob and then another person came along and touched that same doorknob. It could be linens, like from a bed, or even clothing. It could be a common fomite is the healthcare provider's hands. And so that is a powerful way that something can be transmitted from one person to another. And then there are vectors. And these are typically insects or animals that can take that organism and transfer it from one person to the next. These things are used somewhat loosely. They are kind of like all considered to be indirect, and you can probably appreciate that these are a little bit artificial, but it's just important to think about all the different kinds of ways that organisms can get from one person to another, either directly or indirectly. So we can put things in place to help prevent that transmission. Now, once we can appreciate all of those different ways of getting infection from one person to the next, then we can think about ways to not transmit. So prevention of transmission. On an individual, so here I'm going to put prevention. On an individual level, and this can be for both direct or indirect, I would say that hand washing is the single most important thing that people can do to prevent transmission, whether it be because they touched something or got something contaminated, or just by directly touching that particular person. So hand washing is the number one thing that we do on an individual case-by-case basis that we help prevent the transmission of infectious disease agents. On a population level, and we'll learn more about this when we get to some of the policy topics, but there are a couple of things that we can do, specifically quarantine. We can take that person and we can put them where they can't spread that disease. We put them where they can't touch things that somebody else is going to come in contact with unless we've taken care of those particular objects. So quarantine or isolation are a couple of different things that we do. Now, it's important to remember, and this is probably one of the big things about the whole policy behind quarantine and isolation is you are doing something that limits a person's freedom. And you can only do that if that's only justified if it's to prevent harm to another person. And so a lot of times people are like, well, that person has TB or has latent TB and they won't take their medications. Can I put them in quarantine or isolation? The answer to that question has to do with whether you're preventing harm to another person, whether you're preventing that to be spread from the person who's infected to another person, or if you're only trying to better the outcome for that particular individual. So if all you're trying to do is to impact the health outcome for the individual, then quarantine and isolation is often not justified because you are limiting a person's freedom, and just for the sake of that one person, you can't often justify putting somebody in this limited freedom state. So that concludes our talk on infection and transmission. Next, we'll talk about immunity.